So, what does NOTE stands for? NOTE stands for Natural Orifice Transluminal Endoscopic Surgery. But since the first polypectomy was done in 1955 by our gastroenterologist colleague, major advances in technology and refinement in endoscopic technique has allowed our GI colleague to perform complex endoscopic intervention, such as the endoscopic mucosal resection, EMR, or the submucosal dissection for early gastric cancer. In prior to the development of multi-channel flexible endoscope with novel image manipulation like narrowband imaging, autofluorescence or immunofluorescence, this led to the reality of more advanced therapeutic endoscopy. So there is a counterpart in the Asia Pacific area in our part of the world. So in 2006, there was a technical working group done in the Asia Pac consisting of Philippines, Singapore, Malaysia, Korea, Japan, of course, India and China, which are one of the highest areas of node surgery. So these represent a major conceptual and technological advances in the field of surgery and endoscopy since the advent of laparoscopy 25 years ago. So, but as of now, it is said to be widely adopted into our daily clinical practice due to the technical challenges. So there are several subdivisions of nodes. So if we go by the operation performed, the simplest would start with cholecystectomy, appendectomy, or peritoneoscopy, or staging laparoscopy for gastrointestinal cancer before any surgery. The orifices used are usually transoral, transvaginal, transanal, transgastric, or transcolonic. Also, whether it's a distant target or a direct targeted organ, okay, or a pure hybrid, meaning combine natural orifice with standard laparoscopic procedure, such as the transvaginal appendectomy is a pure NOTES procedure, while transvaginal and transgastric nephrectomy is a combined or a hybrid. And lastly, it depends on whether you're using a flexible scope or a rigid scope. So the ultimate goal remains that the design and production of a flexible endoscope or a NOTES platform that is multi-channel can bend more than 3 degrees or axis, but which can also be stabilized once the correct operating position has been reached in order to carry out the required procedure. So once we achieve this, a solid platform, in order to maintain or permit at least 2 instruments to manipulate for safe surgical dissection, then we can start pushing the limit of nodes.